As you can see in this angiogram, we do also angiogram of the heart. The blood actually went outside the heart. It's free wall rupture. Patient was taken to the OR, but she didn't make it. I had an old lady. She was in a motor vehicle accident, deceleration accident, and she ruptured the distal part of the septum. She was not repaired, but she was doing okay. So this can be diagnosed very accurately by TEE. This patient is a 48-year-old gentleman with a, let's see, the videos are not playing, but I'll just go here. The video is not playing, but this is a big thrombus in the left atrium, protruding the left ventricle by TEE. And we were wondering what to do with the patient. The surgeon was not very aggressive, and 2 days this embolized into the pulmonary artery. The patient didn't make it. And of course, patient with so-called occult mitral stenosis. I had a 42-year-old gentleman who was reported for a heart transplantation. Of course, the other hospital missed the mitral stenosis. The mitral stenosis was apparent on this transthoracic echocardiogram. It was further confirmed by TEE, but you don't need to do TEE in a mitral valve patient. Just transthoracic enough. Similarly, patient with severe aortic stenosis was confirmed by TEE. He was hypotensive, and the valve was repaired. Flail mitral valve, unfortunately videos are not playing. A patient came in with inferior myocardial infarction, and right coronary artery angioplasty and stenting was performed. And then, of course, if the patient became hypotensive soon after the stent, then we couldn't understand why it was the case. We checked the stent once again. It was open. Then, of course, there was a resistant hypotension. So we did a transthoracic echocardiogram and showed the prolapsed mitral valve, rupture of the cardiac tendinae that was causing hypotension. And of course, it was confirmed by TEE, and then patient had repair of the mitral valve, and patient did well. There was a severe mitral regurgitation from that. Of course, one of the most common conditions for the hypotension and shock, septic shock, is of course endocarditis of the aortic valve as well as mitral valve. In this case, there was a vegetation on the aortic valve, aortic cusp here, that confirmed on the TEE. And also, another patient came in with vegetation on the atrial aspect of the mitral valve and vegetations on the in the eustachian valve of the right atrium, and also right ventricle outflow tract, multiple vegetations on TEE. And also another patient came with aortic valve vegetation, another patient with a mitral valve aneurysm and a hole, perforation of the mitral valve, and another perforation of the aortic valve. These can clearly demonstrate where the problem is and how this can be corrected. In this patient we talked about had a non-bacterial endocarditis, and that caused this problem here, and that came from this pelvic mass. So in summary, TEE examination, critically injured patients and also sick patients, is very prompt and portable and is convenient. And TEE-based diagnosis as well as management will save the patient's life. So it's extremely important to do TEE very promptly so that it is very useful. Thank you very much for the attention.